Slow sand filter. What is the size of the sand particles? Where do you find vital layer? All these things are very important. Sand filter is going to elevate you towards the top rank in the entrance. So you need to remember, doctor. So vital layer, whenever the filter is newly laid, it acts only as a mechanical strainer. It has no biological activity. But very soon, the surface of the sand belt will be developing a lot of slimy growth, which is called as the smudge vital layer, and it is this which will have all that important filtering properties. And the formation of this vital layer is called the ripening. And the heart of the slow sand filter is the vital layer, is the rule that you should not forget. It removes the organic matter, it holds the bacteria back, it oxidizes the ammonical nitrogen, and it helps in yielding a bacteria-free water. So growing of this vital layer is very, very important. Let's go to the next question. Vital ICD is reviewed. The International Classification of the Disease is reviewed every 10 years is what need to be remembered, doctor. And action which halts the progress of the disease in the incipient stage, what is it called as? It is called as secondary prevention. Primordial means what, doctor? Before the emergence of the risk factors only to stop it. Before the onset of the disease, the action taken is called primary prevention. Early diagnosis in the treatment and halting the progression in the incipient stage is called the secondary prevention. So these questions are invariable. Once for our favorite case control trial has come, one question is invariably going to come out of 200 questions. So please remember, it's very easy to carry case control study. In your ward only you can decide. Ward number 1, this fellow with smoking with bronchogenic carcinoma is a case. And the other ward, gynecology ward patient is a control. So that way you can choose it. So very easy to do, very rapid you can do. In 1 month you have to submit your thesis, you can finish off the study. So it is very inexpensive also, unlike the cohort Framingham study, you require to have national funding. And it requires comparatively few subjects. 20 people here, 20 people there, you can conclude that in Hyderabad city, lung cancer is more. You can't conclude because attributable risk cannot be given in the case control trial is what need to be remembered. And it is particularly suitable for investigating the rare diseases. For example, some XYZ ABCD syndrome is there and it is seen in pediatric population, you are a pediatrician, you have a lot of flow. So I can't go on checking XYZ rare syndrome in the whole of the population, all the money funding will be exhausted. In contrast, I can come to your pediatric hospital, I can say that you are a great surgeon who will only treat XYZ ABCD syndrome, sir. So I want to do case controls trial in your hospital, you can say. So it can be done for the rare diseases. Several etiological factors can be studied at once. Why, doctor? The outcome already happened or is it going to happen in a case control study? Already happened. Retrospectively you are checking. So you can say, sir, you are having bronchogenic carcinoma, did you smoke? Yes, sir. So probably smoking is the reason. One etiological factor you studied. Sir, did you diverse, sir? Sir, I diversed 5 times, sir. So out of 10 people who had bronchogenic carcinoma, most of them have diverse. So diverse is a risk factor. For more smoking, probably that led to the development of bronchogenic carcinoma you can implicate. So multiple etiological factors can be studied in a case control study, but not in cohort study is what I want to underscore to all of you. Risk factors can be identified, rational prevention control programs can be established, and there is no attrition problem. Out of these 20 patients you are checking, 5 of them dropped, you can bring 5 more and then carry on the study. In cohort study, you are studying 10,000 people, then some major part of them can drop down and your study can stop. So attrition is a problem in cohort but not in a case control trial is what need to be remembered. Ethical problems are very minimal. You can place all the patients in Viceroy Hotel and complete your study. Whereas cohort means suddenly newspaper fellows will come and say that I think nowadays you are studying about marital disputes in our community, communal riots can occur, you can't do that, they can stop you. So cohort will have more amount of ethical problems. Now what are the disadvantages? It relies on the memory or past records, so bias is more common. Sir, you are a depression diagnosed patient, did you eat idlis in the past 20 years? Yes, I eat a lot. How can you rely upon that information? You can't rely. So there is a reason, because it is somewhere 20 years onwards what he can say, so there is a reason bias can occur. Accuracy is very uncertain. Validation of information is impossible. So there is a reason there is a major problem of bias. Selection is also very difficult because a perfect case is never existent, no perfect control is existent, and we cannot measure the incidence because population is not defined in the denominator, hence incidence cannot be calculated. You can't use it to evaluate the therapy or prophylaxis of the disease is what I want to underscore. So they are all the major disadvantages. What are the non-contraceptive protective advantages having had taken the oral contraceptives, doctor? Typically, they cause protection against 6 diseases: cystic ovarian disease, iron deficiency anemia, pelvic inflammatory disease, ectopic pregnancy and benign breast disorder. So they are all the ones against which they provide the protection. But hepatocellular adenoma and gallbladder disease, they predispose is what need to be remembered. Dates are rich source of what? Iron. That's good. So liver, meat, poultry, fish are very good in heme iron, and non-heme iron, the nuts, jaggery and oil seed and the dried fruit, dates are very, very important is what need to be remembered. Now what is the test of association between two variables called as? Correlation. Then is the regression is a test of dissociation? What is the difference between correlation and regression is my question to all of you. Please remember, I'll come to that point. Please remember that the degree of the association is basically measured by doing a correlation coefficient. What you can see is if the correlation coefficient is -1, then it will be a curve like this. If it is +1, as one variable is increasing, the other variable is increasing. But as one variable is increasing, other variable is, if it is decreasing, then it will be of this shape. And this is, if there is no association, they are randomly scattered. That's what need to be remembered. So this gives an example of a scatter diagram of 15 children, the relation between their height and the pulmonary anatomical dead space. So, do you think that there is a correlation or they are more scattered? There is a correlation. If so, then is it R is equal to 1 or R is equal to -1? It is 1 because it is progressing in that direction. If it is coming in this direction, then it is -1. So, correlation talks about the strength of association between two variables. It is very symmetrical, and if A and B are correlated, then B and A also are correlated. Both the statements are true statements. But if there are two variables, if they are related, then if one changes by certain amount, then the other also will be changing by certain amount. Regression comes into picture. It speaks about how much the other variable will change if this variable changes. That is calculated by regression. If this changes, that is also changing. That association is spoken by correlation. So this difference need to be, so correlation is more of a qualitative term and regression is more of a quantitative term, where if independent variable is changing, how much the dependent variable is changing, that is called regression, is what I want to underscore to all of you. Let's go to the next question. Midday school meal program, what are all the true statements? So please remember that it is not a substitute like any coaching program, midday coaching program. So it is not a substitute, but it is just a supplement is what need to be basically remembered. Locally available foods are used and cheap and easy to prepare and should supply half the daily protein and 1/3 of the total daily calories. So we'll ask the chairman, today's session is providing how much calories, doctor? I hope it can't provide more than 1/3 of the total preparation. So that's the reason you need to read, doctor. You need to know what are the high yield topics, how to remember for yourself. This session provides you an opportunity to know what they are. So we speak of correlation, you need to be strong in your regression. Okay, so let's go to the next question. Which is the flavivirus which is closely related to the Russian spring summer encephalitis? This is a typical question, chairman. So please remember, it is typically KFD, both of them are basically tick-borne is what I want to underscore to all of you. Let's go to the next question. Which drug does not cause convulsions? Otherwise, which is the anticonvulsant? Lamotrigine. So questions will be so simple in the state entrance that even examiner will think, why to ask mechanism of action of the anticonvulsants? Our boys will be really so tiring to write this entrance exam. Let them identify which is the anticonvulsant. That much simple question can be there. That's the reason don't be afraid to see a question like this in tomorrow's exam. What is the mechanism of lamotrigine? It is similar to that of the carbamazepine. It blocks the voltage sensitive sodium channels is what need to be basically remembered. By doing so, it stabilizes the presynaptic membrane and it prevents the release of the glutamate. So they are all the major things I want to underscore to all of you. And it is generally used only as an add-on therapy in the refractory cases, but not like a first-line therapy, the lamotrigine. Now, I'll give you a similar question. Lithium, what are all the drug interactions? What is the therapeutic window? One favorite question of the examiner. Out of all these drugs, to which drug does the lithium will interact, doctor? Very dangerously it will interact. Yes? Clomipramine and lithium, they can interact with each other dangerously, whereas the other things are okay. Along with lithium you can give them is what I want to underscore to all of you. Let's go to the next question. Renal dysfunction, which drugs you can give, which drugs you should not give is a favorite question of the examiner. So please remember, doctor, rifabutin, rifampicin, rifapentin, there is no need for change of their dosage if the creatinine clearance is less than 30 ml per minute is what I want to underscore to all of you. Now tell me, what are those cephalosporins which can be given in renal failure, doctor? Cefamandole, ceftriaxone, cefparazone. These three important drugs can be given. Cefparazone, ceftriaxone, these two important drugs can be given in a patient who has got a renal failure is what I want to underscore. And can you give doxycycline in the case of the renal dysfunction without dose modification? Now let's go to the next question. Chloroquine toxicity can cause myopathy, retinopathy and the GI bleed. But I am treating a patient for malaria with chloroquine. Do you expect that he will get retinopathy because of that? Okay. Otherwise, chloroquine is used for long period of time for which indication, doctor? In the case of the rheumatoid arthritis, you can use chloroquine if it is, and similarly if there is a patient with limited arthritis, inflammatory arthritis, you can use the chloroquine. There you have to regularly check the fundus for the chloroquine toxicity. Which antihypertensive you cannot be given in pregnancy? ACE inhibitors. And for the treatment of giardiasis, which zole you cannot use? You can use metronidazole, tinidazole and also furazolidine, but not mebendazole is what I want to underscore. And the most commonly prescribed antibiotic for the giardiasis would be metronidazole is what I want to underscore. Now this is a classical appearance of a cyst form of the giardia lamblia, and these are the trophozoites of the giardia lamblia. String test is the one, duodenal string test is the one which we will be using for the giardia lamblia. These three buzzwords which you should not forget. In which conditions leukocytosis is produced? If you give lithium or steroids, you can produce leukocytosis. That's the reason in certain leukopenic patients, lithium can be used to raise their WBC count. One of the indications which you need to remember.